It might be unexpected, but regularly consuming the wrong types of nuts can increase your risk of heart disease by up to 48%, especially for older adults. That figure does have a certain reasoning behind it. This study draws upon research published in the Journal of the American College of Cardiology, conducted over several years. The chilling aspect. Certain commonly stored nuts in kitchen cabinets may subtly elevate blood pressure, trigger inflammation, obstruct arteries, and potentially worsen cognitive decline. However, numerous older adults consume them under the impression that they are beneficial for their health. A particular nut, the details of which will be disclosed later, has been linked to elevated levels of a toxic compound that, if consumed frequently, may adversely affect your liver, kidneys, and mental functions. This familiar nut, likely residing in your snack jar and often praised by low-carb enthusiasts for its health benefits, might actually be inflicting lasting harm on aging bodies. Rest assured. This video has everything you need. This guide offers an in-depth look at nut consumption, detailing the safest options, those that promote heart health, and the varieties that support brain function, alongside a list of nuts to steer clear of entirely. Make sure to read through to the end, as there's a hidden truth regarding the most perilous nut that hardly anyone talks about, and it might be significantly affecting your health without you even realizing it. Please give this video a thumbs up and subscribe to our channel for more content like this before we dive in. We'd love to hear from you. Share in the comments where you're tuning in from. Without any delay, let's dive into the 4 varieties of nuts that are beneficial for seniors to include in their diet. Fourth, the ultimate force for enhancing bone strength. Almonds. An almond stands out as one of the finest foods for an aging body, owing to its rich calcium and vitamin E content, which work in harmony to maintain strong bones. As we grow older, fractures tend to lead to more significant complications due to the natural porosity and brittleness of our bones. After the age of 65, the process of natural bone loss accelerates, yet incorporating a mere quarter cup of almonds into your daily diet can aid in mitigating this decline by supplying around 97 milligrams of calcium. Almonds are not just a source of calcium, they also provide magnesium, a mineral that is often deficient in the diets of many elderly individuals. This is what sets almonds apart in a remarkable way. Magnesium acts as a crucial mediator, safeguarding your arteries from calcium's potential harm while facilitating its journey to your bones. The monounsaturated fats found in almonds contribute positively to heart health by reducing levels of harmful LDL cholesterol, an important factor as the risk of cardiovascular disease rises with age. I recommend a daily serving of 15 to 20 almonds for seniors, preferably uncooked or dry roasted without salt. Almonds serve as an effective ally in the battle against constipation, boasting a fiber content of around 3.5 g per serving, which affects nearly 40% of individuals. Research from Tufts University has revealed that almonds may play a role in preventing oxidative damage to brain cells, a concern for many as they age. Seek out almonds that still have their skins, as the skins contain flavonoids that, when paired with vitamin E, enhance the almond's antioxidant properties significantly. Attention! Almonds pose a potential choking risk for older adults who may struggle with swallowing, so it's important to chew them thoroughly before consumption. Thirdly, walnuts, the nut that enhances mental clarity. Due to their remarkable similarity to the brain, the organ they nourish, walnuts are recognized as one of the top foods for cognitive health in seniors. These remarkable nuts stand out as the top source of the plant-based omega-3 fatty acid alpha-linolenic acid, surpassing any other well-known nut. This holds great importance for the minds of older adults, as omega-3 support neurotransmission and maintain the integrity of brain cell membranes. A recent study published in the Journal of Nutrition revealed that seniors who consumed merely 1.5 ounces of walnuts each day for 8 weeks exhibited notable improvements in cognitive processing speed and mental flexibility. The unique polyphenolic compounds found in walnuts have the potential to hinder the progression of neurodegenerative diseases such as Alzheimer's and dementia. They achieve this by crossing the blood-brain barrier and directly addressing inflammation in neural tissues. It's not widely recognized that walnuts also have melatonin, and as people age, their melatonin levels typically decrease, often resulting in sleep issues for numerous older adults. Many individuals discover that consuming a small portion of walnuts prior to sleep enhances their overall quality of rest. The unique blend of arginine, an amino acid that enhances blood vessel function, along with polyphenol that reduce oxidative stress, renders walnuts exceptionally advantageous for cardiovascular health. Indeed, walnuts can amplify the benefits of blood pressure medication by helping older adults maintain the flexibility of their arteries. To maximize benefits, store walnuts in the refrigerator to preserve their delicate oils from going rancid, and aim to consume 7 to 9 halves daily. Additionally, you can maintain your fine motor skills by cracking them yourself whenever the opportunity arises. Don't let the inherently robust taste of walnuts deter you. The slight bitterness serves as a sign of their powerful antioxidants. Additionally, pistachios serve as an excellent means to manage your blood pressure. Pistachios might just be the most overlooked nut when discussing the health advantages for seniors, particularly in terms of managing blood pressure. Pistachios stand out due to their low salt content and impressive potassium levels, approximately 285 milligrams per serving, making them an excellent choice for a healthy snack. The balance of minerals holds particular significance for older adults, as it aids in preventing the kidneys from retaining salt as we age. It has the potential to reduce systolic blood pressure by 3 to 5 points, similar to certain prescription medications, yet without the adverse side effects. Furthermore, it is important to emphasize the presence of lutein and zeaxanthin in pistachios, as these carotenoids play a crucial role in safeguarding against age-related macular degeneration, which is the leading cause of vision loss in those over 60, by focusing on the macula of the eye. Older adults can savor the enjoyable crunch of pistachios without the concern of potential harm to their teeth and gums that might arise from other, tougher nuts. Beyond their visual appeal, the antioxidants found in their unique green and purple colors play a crucial role in neutralizing free radicals that accelerate the aging process within the body. Pistachios offer wonderful benefits for older adults due to their convenience. By preventing overeating and providing a mindful eating experience that is both calming and stimulating for cognitive function, the process of shelling them inherently encourages a slower pace of consumption. The International Journal of Obesity highlighted that the clear empty shells assist seniors in managing their intake by serving as a visual cue for consumption. If you experience arthritis in your hands, you can still relish the pleasure of shelling pistachios by looking for those that are partially opened. Strive to consume around 49 pistachios daily, which is about 1 ounce, opting for unsalted or lightly salted varieties. For the quarter of Americans aged 65 and older who are diabetic or pre-diabetic, the 3 grams of fiber found in each ounce of pistachios can significantly aid in managing blood sugar levels. Brazil nuts take the lead. A solution for thyroid health. We placed Brazil nuts at the top of our list due to their positive impact on thyroid function, a crucial yet often overlooked aspect of healthy aging. Containing 96 micrograms, which is 137% of your daily requirement, just one of these remarkable nuts stands out as the most abundant source of selenium available. Many cases of thyroid diseases remain untreated, as symptoms are frequently confused with natural aging. This is crucial to note, given that thyroid disorders affect up to 20% of individuals over 65. Selenium, found in abundance in Brazil nuts, plays a vital role in activating thyroid hormone, which subsequently aids in energy production, metabolism, and mood regulation. Alongside their role in supporting the thyroid, the unique fatty acids present in Brazil nuts contribute to the maintenance of myelin, the protective layer surrounding nerve cells that tends to diminish as we age. Older adults might retain their reflexes, reaction times, and cognitive processing speeds due to the upkeep of myelin. The selenium found in Brazil nuts is fascinating due to its organic bonding, which enhances its bioavailability and makes it more readily usable by your body compared to synthetic selenium tablets. Brazil nuts possess such potency that just a handful can deliver significant benefits. Their luxurious, velvety consistency ensures that even a small quantity is delightful. Indeed, I recommend that seniors limit their intake to 1 or 2 Brazil nuts each day, considering the possible adverse effects of excessive selenium consumption. When selecting Brazil nuts, aim for those that remain encased in their shells. This organic packaging preserves the nutrients for an extended duration. Store them in the fridge to prevent spoilage from their elevated fat levels. The unique blend of fiber and natural oils found in Brazil nuts supports intestinal regularity, providing a beneficial option for seniors dealing with constipation. Numerous older individuals discover comfort in snacks that may lack nutrition, yet these options stand out as a delightful alternative due to their inherent sweetness and rich buttery taste. Recent findings indicate that certain antioxidants present in Brazil nuts could potentially decelerate the natural reduction of telomeres, the protective ends of chromosomes that typically diminish over time, thereby affecting the process of cellular aging. For those aged 65 and above, these nuts are an excellent choice. In this upcoming segment, we will explore the topic of nuts, which certain seniors might prefer to steer clear of or consume with care. While commonly consumed, peanuts pose significant risks for numerous elderly individuals because of the hazards they entail. First and foremost, it's important to understand that peanuts are not true nuts. These are legumes cultivated beneath the surface. This renders them vulnerable to mold and aflatoxins, which are mycotoxins produced by specific molds and can be detrimental to the liver, elevating the risk of cancer with regular consumption. As we age, the efficiency of our body's detoxification processes naturally declines, leading to an increased risk. It is particularly concerning for older adults that peanuts contain proteins which could trigger inflammatory responses in some people, even if they do not have a true allergy. Older individuals face an increased likelihood of experiencing joint pain, cardiovascular strain, and cognitive decline. This mild inflammation can exacerbate all 3 conditions.Many individuals in the United States currently intake a surplus of omega-6 fatty acids in relation to the beneficial omega-3s that help reduce inflammation. The elevated omega-6 levels in peanuts contribute to this issue. Numerous physicians overlook the importance of informing their older patients about the serious risks associated with the combination of peanuts and blood thinners, such as warfarin, due to the presence of vitamin K in peanuts.The inclusion of hydrogenated oils, increased sodium, and sugars in store-bought peanut butters exacerbates these issues for aging cardiovascular systems. A significant portion of American seniors grappling with hypertension already faces numerous concerns. Even in its pure form, natural peanut butter has the potential to elevate blood pressure levels. If not stored correctly, peanuts can spoil and generate harmful free radicals, presenting yet another concern.The prevalent method of dry roasting peanuts for commercial purposes generates acrylamide, a substance that may have detrimental effects on cognitive function. This is particularly troubling for those who are already anxious about memory decline. Even if you've been enjoying peanuts consistently without any apparent issues, trying one of our recommended nuts for just 3 days a week can provide essential nutrients while reducing your exposure to potentially harmful substances. Third, cashews, the rise in sugar that isn't obvious at first glance. Given their significant carbohydrate levels and glycemic effects, cashews present a particular concern for older adults. Cashews contain fewer fiber-protective compounds and significantly more carbohydrates, around 9 grams per ounce, compared to true tree nuts. Approximately 1 in 4 individuals aged 65 and older are affected by diabetes, while nearly half of this population is classified as having prediabetes. This triggers a blood sugar response, which can be detrimental to their health. This situation is especially concerning given the favorable health image associated with cashews. Many older individuals consume nuts in large quantities without considering the potential impact on their blood sugar levels. The elegant and rounded form of cashews presents a potential choking hazard that must be taken seriously, particularly for those who have difficulty swallowing. They are also among the most sought-after nuts by seniors. From a nutritional standpoint, cashews may not be the best choice due to their high oxalate content. These compounds can bind to calcium in the digestive system, potentially reducing calcium absorption. This poses a significant concern for older adults, who are already at an increased risk for osteoporosis. Individuals who are already at heightened risk for kidney stones face a significantly greater threat after reaching the age of 60, largely due to the presence of these same oxalates. An additional hidden issue exists within the cashew processing. During the extensive processing needed to extract urushiol, a toxic compound present in poison ivy, cashews lose a significant portion of their nutritional value. Numerous commercially available options are often roasted in oil and heavily salted, introducing unhealthy fats and sodium that can exacerbate blood pressure and strain on the heart. Cashews have enzyme inhibitors that may impede the digestion of proteins. This poses a significant challenge for older adults who often struggle with food digestion and protein absorption as it stands. A surprising number of individuals remain unaware of this fact. The rich, creamy texture of cashews can lead to overindulgence, posing a challenge for those striving to maintain a healthy weight during a particularly difficult life stage. Swap out cashews for walnuts or almonds regularly to enjoy a healthier snack that offers fewer risks to aging bodies while delivering enhanced nutritional benefits. Due to their remarkably high calorie density, macadamia nuts present a notable health concern for the elderly, even though they are undeniably delicious. These nuts stand out for their high caloric density, offering approximately 200 calories in just 1 ounce. The decline in metabolic rates that comes with age complicates the already challenging endeavor of weight management for older individuals. The gallbladder's already reduced functionality is worsened by the remarkably high fat content, approximately 22 grams per ounce. Macadamias can trigger painful episodes that might otherwise remain unnoticed by the 15% of seniors who have asymptomatic gallstones. Beyond their caloric content, macadamias stand out as one of the nuts highest in saturated fat, containing approximately 3 grams per ounce. This can elevate LDL cholesterol levels, a concern for many older individuals. Their density and hardness present a significant risk to the oral health of seniors with crowns, bridges, or fragile teeth. This poses a significant challenge for individuals over 65, as enamel becomes compromised through wear and reduced calcium absorption. From a practical standpoint, macadamias rank as some of the priciest nuts, potentially leading seniors who are mindful of their budgets to opt for less expensive alternatives that may be more prone to rancidity or improper storage, thereby increasing their risk of encountering harmful oxidized lipids. The nutritional profile of store-bought macadamias is already poor, and the process of oil roasting and heavy salting only exacerbates the issue by introducing additional sodium and compromised lipids. Their flavor is indulgently rich and buttery, which could easily tempt one to overindulge, especially among older individuals who often prefer more pronounced and robust tastes. It is concerning that numerous older adults consume macadamias under the impression that they are promoting heart health, yet studies highlighting the advantages of nuts for cardiovascular well-being have largely overlooked or minimized the significance of high-fat varieties such as macadamias. Pistachios boast a significantly enhanced nutritional profile that caters particularly well to the needs of aging bodies. If you've been indulging in macadamias frequently, it may be worth contemplating a switch to pistachios. The initial offering, seeds from the pine tree. Pine nuts, recognized as a significant disruptor, pose various challenges for the elderly, with issues that are especially pronounced for this age group. The inclusion of chemicals that interact with over 60% of prescriptions for seniors raises significant concerns, as it suggests that the efficacy of these medications may be compromised or that adverse side effects could emerge. Numerous prescription medications are recognized for their potential interactions, particularly statins, certain antidepressants, and blood pressure treatments prescribed to individuals aged 65 and older. Many healthcare professionals fail to inform their patients about the potential dangers of food and drug interactions, which raises significant concerns. The concern surrounding pine nut sickness is significant, as it leads to a bitter metallic taste in the nuts that can linger for weeks post-consumption. While this might seem trivial, it can lead to severe consequences for older adults, as there is a connection between changes in taste and a decline in appetite and nutritional well-being. Research indicates that a significant decrease in body weight is observed in up to 42% of affected individuals. The syndrome appears to be more prevalent among the elderly, likely due to changes in taste receptors and detoxification processes that accompany aging. Pine nuts are rich in polyunsaturated fats, which can easily oxidize and produce inflammatory compounds. This may pose a challenge for older individuals who are already managing inflammatory conditions such as arthritis. Aspiration may happen due to their diminutive size and smooth texture. This situation raises significant concerns for older individuals who struggle with swallowing or are on medications that cause dry mouth, an issue affecting 70% of seniors managing multiple prescriptions. As we age, the body's capacity to absorb proteins tends to diminish, and the enzyme inhibitors found in pine nuts can further hinder protein digestion during this period. Pine nuts are a calorie-rich food that may lead to weight management challenges often seen after the age of 65, thanks to their high oil content and their frequent use in dishes like pesto, which is their most popular culinary use. Worryingly, recent studies indicate that certain chemicals found in some varieties of pine nuts may act as a potential catalyst for age-related macular degeneration, which is the leading cause of vision loss among older adults. Once you reach the age of 65, it's wise to avoid these 4 types of nuts. The dietary choices one makes about nuts can significantly influence a person's health, vitality, and cognitive function as they age. Finally, remember that consistently implementing small changes can lead to significant results over time. Now is the moment for you to express yourself. Is there any proof that altering your diet, like adding or removing specific nuts, impacts your health? Share with me the nut that has influenced your life the most. Share your reflections and narratives in the comments below. Your feedback is important to us.